Hi, this is Dr. Victoria Andarcia. Thank you for joining me again on the Healthful Roots podcast. Today, I have Dr. Angela Jordan, who is one of my coworkers at Reveal. I'm really excited to interview her and get to know more about what she does and to learn from you today. So here you go.
Thank you so much. Thank you so much. Whoops. Thank you. Sorry about that. Yes, I'm Angela Jordan. I joined Reveal about a year ago, and I'm a family practice doctorate of nurse practitioner. And I'm also finishing up a lifestyle medicine certificate through Florida State University. And I'm here at Reveal seeing some of the more complex patients. But my specialty is really Lyme, cancer, autoimmune conditions, and I do see children for PANS and PANDAS.
Well, going back to the beginning, you started your career in the emergency department. So I want to know, what was that like and what led you into integrative and functional medicine?
So pretty interesting, and I could probably tell a very long story about this, but yes, my first 20 years or so were in the ER. I got into the ER kind of accidentally through a phlebotomy job where they stationed me down there. And I got down there and did a few shifts, and I was like, wow, this place is cool. I want to be here. So I went from being a phlebotomist to getting my LPN. I was actually an LPN for 27 years. That's what I did my first 27 years of my career. But I got a job as a LPN in the ER, and I worked there off and on about 20 years. And then I was having I just had my fourth child, and just felt like I needed to be home more with the kids. So I was home with her. Then I had my fifth child. That was the end of that. But I had my fifth child, and when she was about 4 months old, I just couldn't cut enough coupons for us to make ends meet. So I was like, I got to go back to work. And it just so happened that one of the ER doctors that I worked with for a long time was also internal medicine, and he had a private practice, and it was kind of a functional medicine practice. So he did a lot of thyroid optimization, hormones, and things like that. And so I went and I was his nurse for about 7 or 8 years. And I really liked it. I really liked how he did a deep dive into the why, So that kind of got me interested in that. And then when I decided to go back to school, I changed practices again because I needed something a little more flexible so I could go to school. So I joined another integrative practice, and that's kind of where I really bloomed and grew and built some roots. So, yeah.
All right. So now that we know the background, what are the most commonly treated illnesses that you do in your practice?
So yeah, going back, I do cancer. So I do a lot of integrative oncology. I don't do chemotherapy or anything like that, but I really take a lifestyle medicine and functional approach to figuring out what the triggers are behind the cancer to try to eliminate them and really just optimize someone's health and wellness while they're going through mainstream cancer care. If it's a case where they're kind of on the other side and they've already been treated for cancer, then I'm looking at how can I keep a recurrence from happening. So again, you're going in and looking for underlying, triggers and inflammation and immune dysfunction that can kind of, cause those cancers to come back, and just, going at it with a lifestyle approach. So integrative cancer care, Lyme disease. I had Lyme disease myself, so I'm a real empathizer of somebody with Lyme disease. And like I was telling you earlier, I think everybody has Lyme disease. But most of the time, if I meet with someone and I tell them I think they have Lyme disease, most of the time they do. So you just have to find the right test. But anyway, so I do Lyme disease, viral reactivation like EBV, autoimmune. And then I have one of my specialties with kids. I don't see a lot of kids, but I am on the PANS and PANDAS network. So I kind of specialize in the neuroimmune dysfunction in that area. So, yeah.
Okay. So I did want to ask you, and since you touched on it, a little bit more details about the cancer patients that you work with. Specifically, how exactly is it that you're supporting them? And I know that you use RGCC testing. How can you use that to individualize care?
So RGCC is very cool. I learned about RGCC at my previous practice, previous to Reveal, and I worked with them for about 8 years before coming here. So I learned a lot. But RGCC stands for Research Genetics Cancer Center, and it's out of Greece. It's a lab in Greece, and they develop cancer testing and therapies that are all, just from your blood. It's not a tissue sample, it's a blood sample. So let's say you came to me and said, hey, I have a lump in my breast. They want to do a biopsy, and I don't want to do a biopsy. What are my other options? So I'm not saying no, that you shouldn't go do a biopsy if your doctor recommends it. I don't want to say I'm giving that advice, but I'm giving you alternatives. So I would tell you to do an OncoDeclare, which is a screening test that's just a blood sample, and that will tell if there's any immune dysregulation or any evidence that your body has recognized a cancer that's brewing in your body. So if we get a positive on that, then we go further and we do the OncoTrace, which looks for actual cells. You can pick up cells, cancer cells, before a tumor ever forms. So the only time that it doesn't pick up is if it's encapsulated. So you have to be a little careful with breast cancer, because if you have a breast cancer that's completely encapsulated, it might not pick up those cells, or something that is within the blood-brain barrier. It won't detect that. But, if there's just some free-floating cancer cells in your body, it's going to pick that up. It'll give us a number so we know what the concentration of that is. And then we take that a step further, and we can do a test called Onconomics Plus that actually tests those cells against a host of a lot, I don't know, I think it's over 50 chemotherapeutic drugs, and then also natural supplements. So the natural supplements is a part that I use. So I take that list of natural supplements, I take the sensitivity, and I build a supplement protocol that's using supplements with less side effects, obviously, than chemo, that can fight the cancer, both killing the cancer and stopping the growth.
Okay.
So it's pretty cool.
Okay. And you're saying that they can come to you and do that before, during, and even after?
Yes.
Okay.
Yeah, or alongside. I have lots of patients who are still currently going to an oncologist, but they're seeing me for that integrative part of it. And we're doing the supplements, we're doing lifestyle, we're looking at, eliminating stress, we're looking at optimizing the diet, eliminating sugar and things that are inflammatory, making sure they're getting enough sleep, making sure they're getting exercises. The whole 6 pillars of lifestyle medicine is very important with cancer care and treatment.
I agree. That's probably how I would recommend someone do it too, right? Because it probably helps, if you're doing chemotherapy, make that a little bit easier to tolerate as well.
Right. You want to keep your body as healthy and strong as possible.
Yes. Okay. So moving away from cancer.
Okay.
So you have a new complex patient walk in. What are the first 3 things that you're trying to figure out or that you're thinking about during that consultation?
So always want to start with gut, because gut health is so important. If your gut's not healthy, nothing else is going to be healthy. Toxin testing, because we get sick and die because of toxins that we're exposed to. And we live in a pretty toxic world. So we just need to measure those toxins and kind of see what we're dealing with, because those are triggers of a lot of things. And then third, I guess it would depend on their symptoms. I would probably have to lean toward the tick-borne test, because, again, I think everybody has Lyme. Tick-borne test for Lyme disease, co-infections, and also a bunch of viruses. And these viruses can get reactivated like Epstein-Barr, and then, that can cause all kinds of immune dysfunction. So usually if they're coming to me, I'm usually doing a tick-borne on them, if somebody hasn't done that already.
Okay. What symptoms would make you think that they have a tick-borne illness?
So one of the biggest symptoms of Lyme disease in itself is migratory joint pain. So people can have joint pain, oh, my shoulder. I just had a patient I did Exomine on, and she's like, yeah, my shoulder. If it's just one joint and it's intermittent, I'm not thinking about Lyme disease. But if somebody's constantly coming and complaining to me about joint pain, and it's migratory joint pain and it's multiple joints, and then you pair that with fatigue, maybe anxiety that they've never had before, headaches, brain fog. A lot of the symptoms of Lyme can overlap with menopausal symptoms, right? Or MS. And when I went through my journey with Lyme, I was convinced I had MS, because I had all these MS-like symptoms, which turned out to actually be Lyme. So really, it's kind of widespread, neurological orthopedic symptoms, really, the brain fog, and people that really you wouldn't expect them to have a lot of brain fog, and they start having brain fog. And then you look at what is their lifestyle like, where are they from? Although I'll tell you that Lyme is everywhere. It's not just in Connecticut and Pennsylvania and Michigan. I got Lyme here in Florida. I know exactly where I got it, when I got it. Um, and I had another Lyme patient that told me she was out on Siesta Key a few weeks ago, and she was sitting under a tree doing some grounding and meditation, and she saw 15 ticks. She counted them. Yeah, on the tree that she was sitting under doing her meditation. There were ticks on the beach. God. So you just never know where you're going to see a tick. And they're so small, some of them, that you don't even notice that they've hopped on and latched onto you. And they like crevices. So, like people that don't wear shoes, which I love being barefoot too. But people that don't wear shoes, maybe walk through their grass or do gardening or something and don't wear shoes, they like to go between the webbing of the toes, and you never see them. You don't notice that they're even there. So they'll hop on, they'll suck your blood for, a day and a half, and then get full and pop off. And you never even know they're there. I knew I had my tick bite, but I didn't get a bullseye. I didn't get any of the initial Lyme symptoms, but I was infected. I know exactly when I was infected.
Okay. Did you take Doxy when you
Nope.
saw it?
I didn't even know about Lyme when I got bit. Yeah, I wasn't in the Lyme world yet, so I was like, oh, I got a tick. It's been 36 hours since I got home from my camping trip. Took my tweezers, I pulled it out, went about my way. I was fine. Again, no bullseye, no fever, no nothing. And then it was about 3 or 4 years later.
Wow.
Before I had symptoms. And it was during a period of stress. High stress can reactivate these things, okay? So I sold my house. I was getting a divorce. I went back to school. I moved. My father died. There were 6 or 7 things, and when I look back, that all kind of happened within four months of each other.
Yeah.
And before I knew it, I was started getting all these symptoms that I had never had before. I had been so healthy my whole life. I'd only been to the doctor to have babies. I had 5 natural childbirths, never complained of pain in my life, never had any problems. But I got to the point, I would say probably 2 years into that, of the symptoms getting worse and worse. I was to the point where I almost couldn't walk.
What were the symptoms?
I had a lot of neurological symptoms, brain fog, headaches, really severe headaches, kind of migrainous, migratory joint pain. But I had a previous fracture in my right foot, and that foot, all of a sudden one day I was cleaning I was vacuuming the floor, and I noticed that part of my foot was numb, and I thought I had stepped on something. I have all these kids, and I picked my foot up to pick off whatever I had stepped on, and there was nothing on my foot. But there was about a quarter size spot on the bottom of my foot that was just completely numb. And then that just kept getting larger and larger before my whole sole of my foot was numb. So I went to a podiatrist and I was like, hey, my foot's numb. Can we check this out? I had MRIs, I had x-rays, I had a nerve conduction study. I had every diagnostic in the book. Everything was normal. I went to a neurologist. Got a PCP after never having a PCP. Went to a physiatrist, and finally I was like, I really think I have MS. Can you please order an MRI on me? So she ordered an MRI on my brain and my whole spine. And while I was waiting for that to come back, after everything else had come back negative, I was like, you know what? And at this point I was working with Lyme patients. I was like, you know what? I had that tick bite back. Maybe I should do a tick-borne test. And I did the tick-borne test, and I was full of Lyme and co-infections.
Oh, wow.
Yep. And then I treated it.
How?
Not with Doxy. Not with Doxy. RGCC uses a therapy called Q-Restrain, which is a kind of a microRNA therapy that uses your own blood, and it targets the genetic sequence that makes up whatever specific, target you're going after. So I did one for Borrelia burgdorferi, Bartonella elizabethae, and Babesia microti. And within 2 months after the last treatment, all of my symptoms were gone.
That's impressive.
My foot I could feel again. In fact, I went to Roatan and I did my advanced dive certification after those therapies.
Oh, wow.
And I could barely walk before that. I was like, I'm going to be in a wheelchair.
That's
Yeah.
crazy.
So that's why I'm a huge believer in that. And I rarely use antibiotics to treat Lyme. To me, it's pointless unless it's an acute infection. All the people that come to me are chronic, so doxy's not going to do anything.
All right. So quick question for the people who don't want to do Lyme, a test like Lyme treatment with the RGCC.
Yeah.
What are the options?
So there's other options, of course, like, we can do the standard doxycycline, but again, that might help your symptoms for a short period of time or maybe even a long period of time. But I can tell you eventually they're going to come back. But it's a Band-Aid, but I would use doxy. The other things I use are herbals. There's some herbal tinctures that you can do. It's just like you have to take these for a long time. You have to take them with binders. And again, you have to start from the beginning and you have to get your gut healthy, because I always try to get people's gut healthy anyway before I start treating Lyme, and also looking for mold. So, we do that toxin test, because if somebody's full of environmental toxins, especially mycotoxins, their body's probably not ready to go through the treatment for Lyme. So it's really a whole process of treating Lyme. It's not just like, oh, here's your test, here's your treatments, bye. It's really kind of a long, drawn out process. I'm like, we're going to be in a relationship for like the next year to do this, because we really have to get everything set in motion to where you can detox properly, or you're going to feel sick.
Yes. Okay.
Yeah.
I'm excited because that leads to my next question. So we talk a lot about detox in this clinic. So I just wanted to know, how do you approach detox safely, and especially in sensitive patients, because a lot of the patients that you deal with are a little bit more sensitive to these protocols?
Yes. So you have to detox. I always say go low and go slow. So you have to start out with tiny amounts. Again, making sure that your gut is healthy is the most important thing to start out with. And then using very small amounts infrequently. Like sauna is a great detox, but you can't put somebody in a sauna 6-7 days a week for 30 minutes at 140 degrees. If they're very sensitive, they're going to react. They're going to have huge histamine flares. So you have to take it very, very slow. You have to look at their genes and see if they have MTHFR mutations and things like that, and really kind of get their body in the optimal state, optimize their hormones, optimize their micronutrients, get them as healthy as possible so they can handle the detox.
Yeah.
And then, you offset it with some natural histamine blockers, quercetin and things like that. Give them NAC to help kind of push it through their liver. And it's very personalized for each person. Okay. Yeah. There's no one size fits all with detox.
All right. So if someone thinks that detoxing that we're talking about is just celery juice and sauna, could you give us like an idea? I know it's all individualized, but like, what does a detox protocol look like?
So certainly celery juice is nice. And, if you're going to juice, celery is a good detoxifier, but it's so much more. So you have to look at their genes. You have to make sure that they're going to the bathroom every day. You have to talk to them about their bowel movements. What do they look like? How often are you having them? Are you having loose stools after you eat something? You have to look and see, maybe they need some digestive enzymes or something. But in order to detox, you have to make sure your bowels are moving. You have to make sure that you're hydrating enough, and that you're hydrating with good things like water and electrolytes. Yeah. You have to make sure that they're able to sweat, because if that's another way that toxins come out of your body. So that's one of the questions that we ask in the beginning is, when you exercise, do you sweat? When you use a sauna, do you sweat? Because if you can't sweat it out, they're just kind of the toxins are going to get stuck. So you're going to use things to help push things through the liver. You're going to use binders to then catch them and bind to them. And then you're going to make sure that they can eliminate it and get it out.
Okay.
So, those are some things. Other things we use sometimes are castor oil packs, coffee enemas. I know that sounds gross, but some people live and die by their coffee enemas. Some of my cancer patients from the previous practice love their coffee enemas. You have to be careful with them that you're not doing the wrong temperature and doing them too often. But what else? We do sauna, we do glutathione.
Yeah.
There's all kinds of things you can use. And sometimes you have to do binders depending on what you're trying to kill.
Mhm.
Biofilms are like, that's a whole nother topic.
Yeah.
So you just have to take it easy and find what's right for the person.
Okay.
Yeah.
No, I think that's a pretty solid and extensive answer. Okay. So now that we've talked about these, I wanted you to just walk us through a case that you've had recently so that we can kind of just like tie some of this together.
Okay. I'm going to give you a case that I'm going to talk about this week because it's fresh in my mind. So this is a patient that had prostate cancer. He had a prostatectomy. He had the prostate removed. And then they determined that everything was clear and he didn't need any more treatment. So this was a couple years ago. So he's feeling like everything's in the clear. He's a very healthy guy. He's going about his merry way with life. And he comes across my office. And anytime I see that somebody has a history of cancer, I always talk to them about the OncoTrace test because I think it's very important. So he got the OncoTrace. Actually, Dr. Davis ordered the OncoTrace test for him initially. He got the OncoTrace test. It came back with a 0 cell count. And then the next time he saw me and I repeated it, and he came back with 2 cells. And this was, I think, about 9 months apart. So you go, ooh, whoopsie, 0. Now he's got 2 cells. What happened in that 9 months? Well, something happened to drive that cancer to proliferate, and he doesn't have a tumor.
Yeah.
We did an MRI, and he had a clean MRI the year before. He has a clean MRI now. So he's got no tumor, but he has cells. So now we're working on the cells with the Onconomics Plus supplements. He's doing IV vitamin C. He's on an anti-cancer, low-inflammatory diet. He's trying to mitigate everything that he can in his environment to keep himself healthy, and those cells are coming down.
Okay.
He didn't have to get any other treatment. But just, I'm like, knowledge is power. So would you rather know that you have cells or not know and wait for 10 years later when all of a sudden you're like, oh, I'm having this back pain. And then you go get an x-ray and you've got cancer in your spine, because that's where prostate cancer likes to recur.
Yeah.
Is in the bones. And once it's in the bones, you're just going to have to pretty much live with it. There's not a whole lot that you can do besides radiation.
Okay, so, but what does the future look like for him then? Do you repeat this test until it goes to 0? And then
He's on the supplement schedule. He also did a Q restrain, because you can do Q restrain for cancer cells or Lyme or viruses. So that's the one that uses your blood with RNA. It attaches to the surface of the cell and basically causes it to die. It stops replication. So he's doing Q restrain. He's doing the diet. He's doing the supplements. And then you just keep repeating that test until it's down to 0. And then it's just knowledge that, you need to sustain that lifestyle, that healthy lifestyle.
Okay. And then how often, I don't know, I'm being nosy.
It's
like,
okay.
Let's say everything goes back to normal. How often would you test him after that?
If he was down to 0, I would just do it once a year.
Okay.
Yeah.
That's reasonable.
Yeah. And he's a very stick by the book kind of guy.
Yeah.
So I know that, he's going to take this with him throughout his life, because he wants to live a long, healthy life. So when I say don't eat sugar or limit your sugar, that's going to be a lifestyle change for him. And not everybody is like that.
Yeah.
Not everybody's as good and rigid about that. So it's just, I try to educate people of, this is what your risk is, and these are the things that you can do to mitigate that risk. And then it's up to them.
I agree. I have one last question nobody cares about but me. Okay, so you said that you did the OncoTrace. So it sounds like did you skip the OncoDeclare because you already knew?
I skipped it because he already had a diagnosis. He had if you have a previous diagnosis, you can skip the Declare.
Okay.
Yeah.
Interesting.
Yeah.
Okay. Now, as we wrap up our podcast, I'll ask you a personal question.
Okay.
What are your health non-negotiables that you practice?
That I practice on myself?
Yeah.
Sleep.
Yeah.
I think sleep is very important. That's always been important for me as a mother of 5, that, mama has to have sleep. So, and I have to have sleep for my brain to work the next day. So sleep and really just vacations. I take time to put my phone away unless I'm taking pictures and get away from work and the hustle and bustle. And I go spend time in very remote parts of the world where I can just decompress, because you got to take breaks for yourself, and you have to take breaks to be able to be there for your family.
By decompress, she means jumping out of planes and diving.
Oh no, I haven't jumped out of a plane, but I do scuba dive quite a lot.
Okay.
But I went para. I always get them mixed up.
Is it gliding?
Paragliding. I went paragliding in Turkey over the summer. That was fun. But I'm not jumping out of a perfectly good plane. I'm not interested in that. No, I like being under the water.
Okay, well, that's fair. All right. And as we wrap up, how can patients find you?
You can go to the Reveal Vitality website, www.revealvitality.com. And there's a place there where you can say, contact me, and we will contact you.
And her Instagram.
Oh, I think it's Dr. Jordan.
Okay, I'll link
easy.
it. Yes, I'll link it in the show notes.
Yeah.
Well, thank you for joining us on the podcast today.
You're welcome.
I learned a lot, and I'm glad that we had this chat.
Good. Thanks to you too.